I'm now joined on the line by Dr. John Linton, Director of the International Healthcare Center at Severance Hospital here in Seoul. Good morning, Dr. Linton.
Good morning. Thank you for having me on your program.
It is a pleasure to have you. Thank you for joining us. Let's start off with some good news. From earlier this week, we heard that Severance Hospital announced the very first successful case of plasma treatment for 2 patients. So tell us about the significance of this success. Yes. Please go ahead.
Taking a patient or a person who's recovered from a virus or a bacterial infection and using their serum and processing it and injecting into another person, giving them antibodies to the disease, is actually, to be humble, it's a very, very old technique. It's probably close to 100 years old or maybe more that it's been tried. So this is not really breaking edge technology. However, Dr. Che and his group here did have great success in 2 patients in improving pneumonia in 2 COVID patients, which was was shown on the news. It is another tool of many tools that we have to try to gain control of the worst complication of this virus, which is pneumonia.
Right.
And so that is, you're absolutely right. They were very good in doing this, in trying this, but it is an old technique, and we're very delighted that the results are good anyway, regardless of that.
Because, as you mentioned, it's not a brand new method. It's been around, I believe, to use to treat MERS and other coronavirus outbreaks as well. Because of that, perhaps there's supposed to be fewer maybe side effects, and there are other countries around the world also trying similar plasma treatments. What are the possibilities of this being rolled out on a mass scale to help the more seriously affected patients?
Unfortunately, we have to slow down a little bit. We don't have. It's being done in Europe. It's being done in the U.S. We still, Dr. Fauci of the CDC in the U.S. keeps coming out and saying we don't have the data yet. And I think that's the word of caution in moving ahead. Certainly, it's something to be explored, and certainly we should try it. We don't. President Trump also mentioned we don't have time to try different drugs and different treatments because it's in our face right now. People are dying, and that is very true. But as not just a doctor, but as somebody who tries to practice medicine on scientific basis or evidence-based, we still don't have clinical trials and animal models, and we don't have a lot of data on this. This is the problem.
But okay. Plasma treatment or therapy has seen some success, and I'm sure that we'll continue to see being rolled out in trials, not only here in Korea and around the world. What about the news about this ivermectin, a parasiticide that apparently stopped COVID-19 growing in cell culture, and that excited, I think, quite a lot of people too. What is your take on that?
Definitely needs to be looked into. However, in the case of Ebola, there were I don't want to be negative today, but there were similar anti-parasitic drugs that worked in a petri dish. However, they didn't work in actual studies. In other words, we use the word in vitro, in vivo. To make it very simple, those are in a culture media. When you mix these drugs, then the virus it may be killed. But does it work in a living organism, in a breathing and walking, for example, mammal, or in a rat or a monkey, or whatever you're trying to you infect an animal and then they give the treatment and see if it works. And that we don't have the data on that. And viruses are, in bacteria, with the sulfa drugs being produced 70 years ago, penicillin being produced, those controlling of pathogens were clearly proved and later worked in the human model. But in viruses, it's not. It doesn't always correlate.
Right.
So just a word of caution: definitely needs to be looked into. I was quite elated to see this, but we need to. The good thing is the drug is a drug that's been tested, so we don't have to worry about the side effects as much because we know the drug. So it's
the dosage, right, that they're going to try to match.
Right.
Or
it
test.
Should be absolutely. There's minimum inhibitory dose, and then in this study they found that after 48 hours the virus was absolutely gone. So very, very hopeful. I hope it pans out. If it does, we'll be the company that makes this drug is going to be very busy.
Do you still stand by your earlier statement? In a previous interview, you said that you can expect, at the most optimistic scenario, a vaccine being rolled out in maybe even as early as 6 months. I believe you said that before.
I am a little more optimistic than all the experts are saying.
Right.
A year to year and a half. The Bill Gates Foundation, many scientists with good brains are working on this all over the world. There has to be clinical trials. The red tape, bureaucracy has to be cut. And frankly, some of us have there may be side effects, but I think the risk is so much greater than influenza, with 20 to 30 times greater for somebody dying. So that I think a lot of that will be, I'm cautiously optimistic that we'll be into some type of trial and an attempt for vaccination, because there's a very high chance that this will cycle back in the fall when the weather gets colder. So I think we will not have a fully tested vaccine the way we would want it. That would take a year to year and a half. But I think that the experts in the world are going to take additional risk, and it's my sincere hope, and I pray that by late September, early fall, or that we'll have a vaccine that will at least will be tried.
Right.
Because the ultimate, everybody listening should know that 60% plus of the population has to be immune before we can definitely say we have won out on this virus.
Right. So still a long way to go, but we certainly hope that your optimistic outlook pans out as well. One of our listeners actually sent us a question, Doctor, 8885. Yesterday, I received a text regarding a confirmed patient's travel record, and it turns out he and I live in the same apartment. So the listener is wondering whether they should go under self-quarantine or whether it's okay to go to work.
They should immediately go to the the selective clinics.
Call first and then go, right?
And they call first, go and be tested.
Even without any symptoms?
Absolutely.
Okay.
Even without any symptoms, they should explain the situation. They should also talk to the CDC number, which you've given many times, and get somebody who speaks fluent Korean, and make it very clear what their situation is. And the CDC of Korea is very flexible, has done a good job. I want to say this for the record, and they will follow up on this and give very solid advice. They're doing a good job.
All right.
So I leave it in the Korean CDC's hands.
Dr. Linton, one final question. We've seen the numbers of daily infections hover around the 50 range for the past 3 days. And it seems like there may be some complacency creeping back. We're seeing a lot of nightlife. Seoul has had to order the closure of these nightlife establishments. So I wanted to ask you if you have a final sort of message for our listeners.
I would, older people, and now I'm in an older category, I'm 60, but older people tend to listen more. Young people feel like they're going to, they're immortal. I would like to ask parents all over Korea to speak to your children, give them a call, tell them that this disease doesn't kill a lot of people, but for the people who die, even the young people, it's 100%. So breathe a little more fear into the younger generation and kindly advise them to follow the directives of the government that are handed out, the very sound directives. We've got to hold on. It's very depressing. Even I find myself a little bit depressed sitting at home. But we can we can win this thing, and we can, ultimately we're going to overcome this. It's a matter of time. Koreans are really good at crises. I have great confidence in the Korean people. In the past, I've watched them through the IMF and many other crises and emergencies. We'll get through, but I think the older people in Korea, the parent level of people, need to talk to their younger folks and say, look, you got to protect yourself. You got to social distancing.
We have to do all our part. All of us have to do our part for us to overcome this.
Together.
Exactly.
Correct.
And so, Dr. John Linton, once again, thank you so much for all of your expert advice today and over the weeks as well. Thank you.
It's been a great pleasure.
Thank you.